So I'm going to talk about a full mouth case here. This patient presented with a fractured front tooth. He didn't like the way his teeth looked. He didn't want to do Invisalign on his lower teeth. He was doing it and he got fed up with it. So he said, what can you do for me? So let's just show you how he came in. So this is how he presented. He's had work done and he came in with this type of fracture, which is a very strange fracture, and we're not sure exactly what caused it, but he is a grinder, so that he may be grinding at night. So after looking at him and looking at his teeth, I said, look, the ceramics you've had done, if you look at them, they're very monochromatic. There's no real differentiation. There's zero texture. So there's no texture here. They just look flat as a pancake, and they're just design's not very nice. And he did not like it. I mean, he's a well-to-do chap, and he said, look, what can you do for me? So I looked at him, I said, look, we need to improve your bite, but we also have to give you something to protect you from grinding, because most people are grinding nowadays, including myself. I clench my teeth, so I catch myself doing it, wake up in the morning, and sometimes I even check to see if my veneers are still intact, because I've had no preparation ceramics done myself, and I do wake up sometimes wondering if I've chipped anything, because I know I've been clenching and grinding, so I wear a guard. So what do we do for him? We did it smart. So we did all the top ceramics, look at these new ceramics compared to the last ones. Look at the beautiful texture, translucency. And when I fitted this on the patient, the best thing is that this is life changing. And this is somebody who, for him to say that, it's a big deal. Because he's had work done in the past, and he said this is truly life changing, because it's made a massive difference to his confidence, to his smile. He still has to wear a guard. The ceramics that we are doing here are feldspathic, so they're not the most strong ceramics around, and we don't want, if you have Emax or something like that, they're strong, but you don't get this type of effect. So we still try to stay away from doing Emax where possible, because it's a machine-made ceramic, which yes, you can do some layering on, but it doesn't look like this. So so we managed to transform his smile. We did a full mouth case. We did his lower teeth as well, and the results here, I mean, look at the before and after. It's truly spectacular in terms of how much texture, translucency we've been able to create. That's his after shot of everything. So you can see here, we've completely transformed everything. I'm very happy for the patient, because he's a super nice guy, and we always strive to give someone something special, so that they walk out of it feeling fantastic, and then they go tell their friends, families, and they just generally feel really good about themselves. So just giving some close-ups of this. Look at this translucency that's been created, and this stunning texture. On men, I like to go with a lot of texture. I think it really adds to character. And you can see it here, the crazy texture we've put onto these ceramics, which is spectacular.